Okay, good afternoon, everybody. My name is Sydney Bennett from the Louisiana HIMSS chapter. We are here today to interview Chris Newsom, who is the Senior Director of Infrastructure and Field Operations at FMOL, and also the current president of the Louisiana HIMSS chapter. How are you doing today, Chris?
I'm great. Thank you for asking, Sydney.
Good. Well, just wanted to get started here. You took over president of the Louisiana HIMSS chapter on July 1st, about 2 months ago, and you are going to serve a one-year term as the president. So what makes you excited about being a part of the Louisiana HIMSS chapter?
It's just an exciting time to be in healthcare, honestly, healthcare IT especially. I recently realized that Louisiana bumped up from 49th to 40th in healthcare ratings across nationwide, and you know, hopefully we can accelerate that and keep the momentum going through contributions that IT is able to give to um, our customers, our patients, and ultimately our patients.
So we're about, 2 months into your presidency. What are you looking forward to this year with the Louisiana HIMSS chapter?
We got a lot of exciting things going on. Of course, we got GC3 in Mobile, Alabama coming up in November. That's going to be a really great event. There's a cross-state platform CIO panel that's going to wrap that up. I'm really excited to listen to and see all the other speakers. Of course, HIMSS, Big HIMSS is in Las Vegas this year in March. So that'll be really exciting. We have some local events too that we're trying to outline and get some communication out to everyone over LinkedIn and Twitter and podcasts, so that once we finalize those dates, we'll be advertising those as well. Hopefully, we can get some socials, and then of course the podcast. We started this last year, and it seemed to be received really well, especially in a post-COVID world. I'm hoping that we can accelerate and enhance these podcasts moving forward and try to get one out a month.
Awesome. Looking forward to all that. So what would you say are some of your biggest goals for the chapter that you're looking to accomplish over the course of this year?
Visibility and participation. I think a lot of people don't realize what LaHIMS is and what we do and what we can discuss and collaborate on together. Healthcare is a very community-based field, and obviously patients go from one healthcare organization to another frequently. So I think there's a lot of collaboration that people don't realize in technology, and we've created a lot of silos. And so we're trying to, I'd like to break down those silos and increase communication across multiple different health systems and rural-based community hospitals and clinics.
Sounds exciting. You mentioned earlier that that Louisiana has moved up from 49th to 48th in some areas. How are you hoping that Louisiana HIMSS specifically, how can this little chapter influence some of that impact of healthcare in Louisiana this year?
Well, I think a lot of people are doing a lot of exciting things, with AI and the opportunities there that are enhancing patient care. Everybody's working in discovering new opportunities. At HIMSS last year, AI was a heavy topic, and it's obviously being a very heavy topic in a lot of the centralized participation of partners and products. But, how can we create cross-platform communication with the use of federal enhancements with TEFCA and interoperability, and just create more of a I wouldn't say centralized, but cross-platform, greater enhanced experience for the patient is really exciting. Louisiana HIMSS has an opportunity to talk to multiple disciplines. I being an infrastructure guy, and I can talk to other infrastructure people and folks, but there's informatics people that we collaborate with, and I learn things every time that I talk to other people in other disciplines because I just have no experience in that sort of stuff. So I can ask, how can I help, and how can technology help you, and what are your greatest needs? And some people say, I need to, more data, or I might need, better, experience in the patient room, or whatever that might be. I've learned an incredible amount in my years at HIMSS, and I'm hoping that we can expand that and help educate others on what HIMSS can bring from not just their discipline, but across, um, other areas that they might not even realize.
Sure. And I think part of that, your bubble is FMOL. That's where the majority of your contacts are. I think one thing that the Louisiana HIMSS chapter can bring is connecting you with folks from all the other major health systems and payers and healthcare IT companies and just the entire ecosystem within healthcare in Louisiana throughout some of the events and things that go on. So, just speaking to that, what are some local events that we can look forward to this year?
Well, like I said, we're going to try to do a social event in New Orleans, hopefully in October, GC3 in November. And then a really exciting thing we've used to do, but we haven't done in several years since COVID, is a crawfish boil in the fall. I'm sorry, in the spring, potentially in Hammond, so in a Top Golf event in Baton Rouge. So we're trying to not necessarily keep this localized around Baton Rouge, but extend our presence around other areas of the state. Hopefully we can get up to North Louisiana like we did last year as well. Participation is key. And to your point, there's a lot of other affiliates out there other than, Auctioner and FMOL, and Blue Cross that I think where we can enhance the participation and understand what other people are doing. We have an opportunity for affiliate organizations as well, something that not a lot of people know about, where you can buy a membership to Louisiana HIMSS for your organization, and then everybody under the organization with that email address is able to join for free. So, there's opportunities and versatility around our membership, so where we can create more conversations to continue to enhance healthcare in Louisiana.
Awesome. What are some of the benefits for a healthcare organization to join up for that organizational affiliate program that you mentioned?
Well, I mean, mostly it's through participation, right? So I think opportunities to have conversations and understand what others are doing, because patient care is very community based, like I said, and realizing, hey, somebody's doing one thing over here that on the west side of the state versus the south side of the state versus the north side of the state. Louisiana is very unique in our properties and how we do healthcare and across the entire state. One of the other opportunities not just as an affiliate but through a membership, is the opportunity to go to the GC3, which allows you to speak to other like-minded people or constituents and partners from Mississippi and Alabama. So you can start learning more about what other states in the South are doing, and maybe introduce something new to your organization. Going to big HIMSS, it's kind of overwhelming. It's like everybody's there and there's so many vendors and everything. GC3 allows a little bit more of an intimate experience to where you can speak to the speakers after their panels and, meet others who might have other questions, or maybe they ask a question you want to follow up on and things like that.
Mm-hmm. And I think one of the cool things too about being an organizational affiliate is that HIMSS offers these continuing education credits.
Oh, sure.
That folks, that are required to have a certain amount of CEs per year to, maintain their credentials and licensing and things like that. They have opportunity to leverage some of those CEs through national HIMSS, both in person at the big HIMSS conference in Vegas, but there's also some virtual ones, I believe, that they can take advantage of.
There are several certifications that I personally have been interested in, never had the opportunity to go and take, but I have heard of others going and getting certified through HIMSS. Yeah. That's right.
So one thing we've talked about this year as a board is increasing membership to the Louisiana HIMSS chapter. There's a ton of networking opportunities, a ton of healthcare organizations and healthcare groups out there. People have a lot of options these days when it comes to different groups they can join, and if they're anything like you there and others, there's only so much time in the day to be able to dedicate your time to all of those. So what would you say if somebody's kind of on the bubble, not really sure that there's a lot of benefit for me to join Louisiana HIMSS chapter? What would you say to those listening about why they should join and become a member of the Louisiana HIMSS chapter?
Diversification. I think there's, the opportunity in HIMSS is unique where you can talk, um, you might be able to talk AI opportunities or technology opportunities with other healthcare related professionals and healthcare IS professionals that might not be in necessarily in your silo or you're in your wheelhouse of expertise, to where you can create those cross platform conversations. Um, there aren't there are few, but there aren't a lot that allow such a diverse set of folks. Healthcare IT is so vast and has so many different platforms. The ability to talk cross platform and cross disciplines to others is very, very unique, and that's what HIMSS brings to the table, I would say.
Yeah. I think one thing for me too is just being local to Louisiana. There's not a lot of conferences that, you've got to travel to Las Vegas or Chicago or Orlando or wherever to kind of network with these folks. But there's not a ton of healthcare specific organizations that have local state by state chapters like
That's
HIMSS
fair.
does.
Yeah, HIMSS used to come to New Orleans, but they've since COVID they've kind of skipped over New Orleans and now just go to Orlando, Chicago, and Las Vegas. So, from a local perspective, there's an opportunity for people who don't necessarily have the funding or the budget to travel out of state. It's very, very expensive. So, these social events we're adding locally to other areas of the state of Louisiana, and um, in the podcast allow you to link up and see what others are doing. Hopefully, we can get some government officials in the podcast as well, so that we can interview them and understand how the government is going to assist with healthcare and healthcare IT specifically to expanding that patient care, or enhancing the level of patient care across the state, and maybe go from 40th to 30th.
So, speaking of the podcast, is there anything specifically? Can you tell our listeners a little bit more about what we've got in store this year in terms of the podcast?
Yeah, we're trying to line up several. I mean, obviously start with me, but we're trying to line up several local politicians, and specifically to the state legislature, potentially some federal politicians as well, to understand what their federal agenda is and how they can tie it back to Louisiana. We're also interviewing several other disciplines, nursing leaders, IT leaders, nursing/IT leaders. So, there's an opportunity there to see and have a little bit of in store for everybody, hopefully.
Yep. And a few Louisiana-based CIOs have also committed to being interviewed for the podcast as well. So definitely looking forward to getting those interviews published for everybody to listen to.
Yeah, that's exciting stuff.
Well, anything else that you wanted to mention to our listeners before we have to part ways today?
No, hopefully, this gives you a little bit better idea of what HIMSS and LaHIMSS specifically does, and you can sign up at lahims.org or hims.org. We do have a new website, lahims.org, so you don't have to go to hims.org/Louisiana chapter. It's a lot easier. Um, but I'm looking forward to seeing more podcasts and seeing more folks at the social events. One last thing I would add is we do have scholarship opportunities that you can look up on lahims.org, and for any students pursuing, their master's degrees, you can submit your application and your essay, and that's voted on in the spring. So, and usually that is presented at our award ceremony. So, one thing we are bringing back since COVID, the end of the year LaHIMSS Awards ceremony. Looking forward to a lot more participation so that we can give out a lot more awards, and seeing everybody there in June.
Awesome. Well, and for folks listening as well, that's LAHIMSS.org. Two S's there at the end, only one M. And I think, like Chris mentioned earlier, there's a social event that's going to be coming up in New Orleans in October. So stay tuned to your newsletters for that. You can subscribe to the newsletter via lahims.org. And then we'll also be putting out another podcast come October. So
And look us up on LinkedIn and Instagram.
absolutely. All right, Chris. Well, thank you so much for your time. Good luck
All
this
right.
year.
Thanks, Sydney. Talk to y'all later.